I'm Dr. Timothy Johnston with your post-op instructions for implants and or bone grafting with membranes. If you're watching this video, it's because you've had that procedure, and we need to talk about how to care for the site properly so that it heals well. Number one, expect a little swelling. If you've had that level of surgery done in your mouth, it's going to swell a little bit. We can do some things to help minimize that, and that's what this video starts with. So number one, if you're biting on gauze when you left the office, please continue to bite on that gauze for about 2 hours, changing the actual piece of gauze out every 15-20 minutes. Number two, use some ice in the area. Leave it on for about 10 minutes and off for about 5 to let the blood pool in your face like it's supposed to. But keep it cold for the same time, about 2 hours. Like any sports injury, you want to do that. The bruising that you may get as well. If you had upper implants placed, this may bruise under your eye. If you had lower implants placed, it may bruise down under your neck. The chance of that increases with age, It also increases with the use of anticoagulants. If you're taking warfarin or even just an aspirin a day or Coumadin, if you're on Xarelto, one of the drugs that thins your blood, you can almost expect to have some bruising. It's going to happen, but it's part of the game. It's because we had to get into the gums to put the implant in the bone. So those are the main things for the first part of the day. Keep it iced. Keep the pressure on it, gentle pressure with some gauze, expect a little swelling, and maybe expect some bruising. But going forward, the healing instructions are pretty straightforward. Let it heal. In other words, leave it alone as much as you can. Please don't smoke. If you're a smoker, give it up starting today, or at least for the next couple of days. Smoking inhibits the capacity of your red blood cells to carry oxygen to the site, and that really retards the healing in the area, so try to avoid that. Brushing. Brush all of the teeth that are not in the site like you normally would, and then be very careful brushing for the first week or so around the implant site itself. This needs to happen so that you don't disturb the stitches that are in place and open the gums back up. Eating. You can resume eating right away, but go very soft diet for the first 2 weeks. You want to think about things like fish or pasta, have some eggs, do breakfast for dinner. My wife always calls it upside down day. So have some breakfast for dinner, eat a quiche or an omelet. But go with soft foods. You don't have to stick to mashed potatoes the whole time, but keep it easy for 2 weeks. If you're a denture wearer, do your very best to leave them out for the full 2 weeks as well. If you have to put them in, and I understand socially you will likely have to put them in, but if you do, don't use them to eat anything hard. You're not going to eat chicken or steak with those in. Please limit it to anything about the stiffness of a banana or a hot dog. Medications. You were given 2 medications for sure. One is going to be an antibiotic and then a discussion about the pain control meds. The antibiotic is very necessary. Our mouths are cesspools. There's always bacteria in them, and they will do a fine job of getting it through that incision line and creating a new infection. So take the antibiotics that we've prescribed. The second is the pain control meds. And we've really gotten away from prescribing narcotics like Percocet or Vicodin. We're all about the combination of over-the-counter meds that are Tylenol plus ibuprofen. So follow these instructions. You will be amazed at how wonderful it works at controlling the medications. What was written down for you is correct. You take them at the same time. So you take 2 500 milligrams pills of Tylenol or acetaminophen and 3 200 milligram pills of ibuprofen. So what that looks like over the counter, 2 extra strength Tylenols and 3 Advils. Now don't be concerned about how it's going to affect your body. The Tylenol goes through your liver and the Advil goes through your kidneys, so it's very safe to take together at the same time. And do that every 5 or 6 hours, take it. And again, you'll be really surprised by how well it works at controlling discomfort and pain. The membrane that was put in over the bone graft or implants, that deserves its own special discussion. That membrane is great at 2 things. Number one, it's great at keeping the bone grafting particles in place and keeps them from falling out. Think of the bone particles as a sand mixture, like wet sand. And the membrane, think of it like a Kevlar vest. It's not made of Kevlar, but think of it like a Kevlar vest that covers all that, really protects it and keeps it in place. So that's good. We like that property. The other thing that the membrane is really good at is wicking bacteria under the gums where it tucks under. And that's, of course, a bad thing, and we don't like it. So the antibiotics you're taking will help with that, but that membrane is going to stay in for 3 weeks, and we don't need you on oral antibiotics for 3 weeks. So instead, please go home and find a mason jar or an old mayonnaise jar, something about that size. Put into it 1 cup of water, 1 cup of hydrogen peroxide, and 1 teaspoon of salt. Mix that up a little bit and leave it on your bathroom sink for the whole next 3 weeks. And then twice a day, take a little hit off of that, swish it around your mouth for 1 full minute, and then spit it out in the sink. You'll want to do it over the sink because it's going to foam and you'll look like a werewolf. So anyway, do that twice a day, morning and night, and it will completely neutralize the effect of that membrane wicking bacteria under the gums. And by the way, we'll know if you did it because it's still pure white when you come back to see us in 3 weeks. And if you haven't been doing it, it sort of turns coffee brown. So please don't do that. It really puts the membrane, what it's covering, the bone and the implant, at risk for failure. The stitches are made of that same material the membrane is, sort of that Kevlar-like material. So they're not going to dissolve on their own. We will take those out when we take the membrane out. At that appointment for membrane removal, stitches are very slippery. We'll slip it with a little suture, scissors, slide it right out. You'll barely feel it. And the membrane itself pulling out, people are worried that's going to hurt. It will not. It's kind of like taking a wet Band-Aid off the back of your hand. You can imagine that. Just kind of falls out. It's not a big deal. If you have any questions, any problems, or any concerns, or if it doesn't feel like things are going right, please, absolutely, give us a call at the office. We'd be happy to see you and make sure that things are healing well and doing well. Thanks for watching.